In radiology, we do different types of imaging. We bring the patients in, sometimes they're everyday exams, sometimes trauma. Our job is to bring them to our department. We take films and then we process them and pass those along to the doctor and to our radiologist so they can read them. Every day is different. You never know if it's going to be a slow day or fast pace, which is nice because you always will have a variety. Some days it's just your basic scheduled exams, and other days it's ER patients and trauma. CAT scans are more in-depth. They get different levels of the patient, and they use the dye so they can assess the patient that way. Ultrasound is another area that they go more in-depth, looking at different arteries and things that we can't see on a plain X-ray.
In respiratory therapy, we work with people that have breathing problems. If it's got to do with breathing, you'll find a respiratory therapist there. That could be asthma, it could be bronchitis, it could be pneumonia, it could be a person that was in an accident and can't breathe because of trauma. As a respiratory therapist, we do EKGs. Some of the people we work with are asthmatics, people with pneumonia, people that have had traumatic injury in an accident and they can't breathe because their lungs have been damaged. Whenever there's a trauma, you'll find a respiratory therapist at the head of the bed. Another thing we do as respiratory therapists is we get involved in sleep studies. Doctors send their patients to us. We monitor them at night and make recommendations to the doctor as to what we think is going on with the patient.
The pharmacist has the responsibility of managing the medication needs of the patient. The pharmacist reviews all orders for drugs to be sure that the appropriate dose and schedule have been ordered and that there are no harmful drugs or food interactions. The pharmacist checks to be sure that no drugs are ordered to which the patient is allergic, as well as look for duplication in the patient's drug treatment. If the medication has to be given by IV, the pharmacist will prepare the solution in a special clean room environment. The pharmacist is responsible for dispensing the medication that the patient will receive while in the hospital. This might be directly to the patient or to an automated dispensing cabinet that is located on patient care units. Pharmacist works closely with the patient's physician and nurse for the purpose of providing the best course of drug therapy available.
Being a medical technologist is very similar to being a detective. The test results are the clues, and the patient's diagnosis is the solution. In the laboratory, we perform tests to diagnose disease and monitor the progress of the patient. Phlebotomy is the area where blood samples are collected. Different types of tubes are used for different tests. In hematology, a machine counts the cells in the blood. The microscope is used to determine the different types of white blood cells. In chemistry, instruments measure different chemicals in the blood, such as blood sugar and cholesterol. In microbiology, bacteria from infections are grown on agar plates. Testing is done to identify the bacteria and determine which antibiotics will kill it. In the blood bank, tests ensure that the donor blood and the patient's blood are a perfect match.
Well, When people talk about rehab or rehab services, typically they're talking about 3 different professions that all work together with the same patients. Physical therapists, or PTs, occupational therapists, or OTs, and speech and language pathologists will often work together to diagnose and treat patients from newborns to geriatrics and everything in between. PTs examine patients and develop a plan of treatment in order to manage pain, improve mobility, regain strength, and prevent disability. OTs use similar skills and adapt the environment to help people achieve or return to independence. This allows the patient to return their specific occupation of life. This could mean playing for a child, working as an adult, caring for families, and managing homes for others. Speech and language pathologists focus on forms of communication, allowing patients to fully interact with their families, friends, and within the community. All 3 professions work in a variety of settings, including schools, hospitals, private clinics, and rehab facilities. The work is dynamic and lets you work with people one-on-one, really getting to know each individual. There's no better feeling than helping someone get back to enjoying life the way they are used to enjoying it. In rehab, you will be able to improve these people's lives from newborns to the very old.
When a patient enters the hospital with life-threatening injuries, the specialty diagnostic services play an important role as members of the critical care team. Consider a career in diagnostic services. Entertain the notion you too can make a difference.